In today's digital age, cyber criminals are increasingly targeting healthcare organizations through sophisticated social engineering attacks, putting patient data and care delivery at risk. Our next guest, Aaron Painter, is leading the charge against these threats as CEO of NameTag. After witnessing friends and family fall victim to identity theft, Aaron assembled a team of security experts to build the next generation of online account protection. While together, Aaron shares how NameTag is revolutionizing the ways healthcare organizations protect critical systems and patient information from AI-powered attacks. Join us to discover how Aaron and the NameTag team are helping healthcare organizations prevent account takeovers, reduce help desk costs, and safeguard sensitive medical data in an era of deep fakes and sophisticated cyber threats. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us. Hi, Aaron. Thank you for joining up on our podcast today.
Thanks for having me, Mike. It's great to be here.
Well, given your personal journey of witnessing friends and family fall victim to identity theft and online fraud, and responding by assembling a team of security experts to build the next generation of online account protection, I'm really looking forward to this important conversation today, given the importance of your work in the healthcare industry. But before we dive into our discussion, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Aaron, it's almost time for our community to learn how you and the NameTag team are preventing social engineering attacks by verifying the true identity of individuals and thereby thwarting attempts by cyber criminals to infiltrate businesses. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Listen. I know it's counterintuitive on a podcast when you and I are doing most of the talking, but I wrote a book about listening in 2017 because I'm incredibly passionate about the role listening can have in making someone feel respected. And I believe respect is the gateway to building trust and having successful relationships. So it's been a foundational element, not only in my life, but certainly in the company that we've been building.
Aaron, I will say after now 300 episodes, this is the first time anybody has offered up that piece of advice. I absolutely love it. You actually came out the gates and said, listen, I perked up. I was like, what's he going to say? But you got the hook. I love it. Aaron, I absolutely love that advice, especially now, right? It is so important. There's so many people talking at us, whether it be asynchronously or otherwise through podcasts. Here we are on a podcast talking, vlogs, YouTube, name your source of information. It's coming at us at millions of miles an hour. Everybody talking at us at all times. This power of listening. It is incredible. Is this also a tenet that you are helping kind of drive throughout the entire fabric of your culture of the organization at NameTag as well? Has that been part of how you guys go about listening to your prospects, listening to your customers, and of course, listening to the industry writ large? Has this been something that's been important to you as a CEO to drive through the entire company?
It has. A lot of what I wrote about in my book several years ago was the connection between employees feeling listened to and how they then engage with customers. And my thesis was that it's sort of a virtuous cycle of loyalty. If employees feel like their voice matters and what they say matters, then they're going to be listening intently in customer conversations because they know their manager is going to respond to the feedback or whatever it might be that they hear from customers. And as a result, customers feel that connection to the company. And so we very much try and live that every day, not only in certainly making sure our employees feel listened to, but so much of our direction as a company and sort of how we've gone on our journey to find what to build and frankly, how to become successful has been listening to customers. They pushed us in the earliest days, and frankly, they continue to push us now in helping us decide what to build next and how to make our product better. So it has been foundational for us in creating the company.
Well, we're going to discuss all of that, Aaron, how you guys have kept your ear to the ground, listening to your prospects, listening to your customers, and receiving those signals in the marketplace of where you need to take the company. We're going to discuss all of that and more and how NameTag came to be, where you guys are at, and where you're headed We're going to unpack all of that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Aaron Painter, CEO at NameTag. Aaron, I'm all ears. I am listening. I am tuned in. I cannot wait to hear more of the story of how NameTag came to be. But of course, what led up to the founding of the organization? You have had one storied career. You have done a lot in a short amount of time. Everything from being an executive out there across the literal globe to being an author or otherwise, and now being the CEO of NameTag. We're going to discuss all of that. Then, of course, we wanted to discuss, where is NameTag today? What are you guys solving for specifically? How's it going within the healthcare industry? We need you now more than ever. This is a very, very hot topic within the healthcare industry, as many of our listeners know. And then, of course, we have to be able to turn the tables a bit and ask you how we can be helping you as well. We'll unpack all of that and more as we continue in the conversation. But first and foremost, Aaron, take us behind the scenes a bit. Give us a little bit of that color, that maybe what you don't see printed in the headlines. How did this company all come to be in the first place? Where were those aha moments? Where were you like, you know what? NameTag it is. I have to do this. Like I said, it's been around for almost 5 years, 4.5 years. But where did this all come to be in the first place? Take us behind the scenes there.
You know, like many, I was trying to solve a problem that I was experiencing in my life. You know, a little bit of context and background, you implied, but a lot of my life and career, I was 14 years at Microsoft, most of that working outside the US. My last job at Microsoft was running the enterprise business in Microsoft in China, which was a crazy moment of China's growth in so many different sectors and incredible opportunity to kind of build from the ground up an entire kind of multinational company operating locally in China. I loved that. I loved the entrepreneurial nature of it. And then I was based in the UK running another company that was a close partner to Amazon Web Services. The first partner in Europe. We were helping large enterprises move to the cloud. And I had just sort of left that job. It was just early 2020. And I moved to kind of back to the US. And then all of a sudden, it felt like the world was falling apart because we had a global pandemic. And I was kind of figuring out what to do next. And I just paused my thinking. I didn't have time even because a bunch of my friends and family members started calling me and they said, hey, maybe you know someone at these companies. Can you help me? My identity's been stolen. I said, what do you mean identity's been stolen? By the way, how's it happening to so many people in my life kind of back to back? And I said, I'm going to be a good friend and be a good son. Like, we're going to jump on the phone. We're going to call these companies. We're going to figure this out. And everyone we called had this experience that might be familiar to you and maybe to some listeners. But they had this bizarre process of security questions as a way to verify who we were. You know, what's your favorite color? What street did you grow up in? What's the last four of your social? What's your mother's maiden name? And it was either complicated and tricky to answer, or frankly, so easy to answer that apparently someone had called before we did and answered those questions and was able to take over so many accounts across so many different parts of people I cared about's lives. And that's where it became this moment to me to say, how is it in today's modern world when we can do so many advanced things, we actually can't verify. We actually don't know who a person is behind a screen, whether they're on a mobile phone, whether they're on the phone, whether they're behind a computer screen. We don't actually know which human it is. In some cases, we don't even know if they're human today. And that's what drove sort of this deep personal interest in saying, gosh, there has to be a better way to think about identity in the context of security. In these moments when it truly matters, is this the right person? Namely, around protecting our digital accounts that dominate so many parts of our lives. There has to be a better way to keep these accounts safe. And that's what drove me to eventually found NameTag.
And from there, Aaron, and thank you for setting the stage. And from there, of course, as any diligent entrepreneur would do before jumping off that proverbial cliff, did you do that market scan? And what did you see out there, was status quo of like, oh, we always did this, but of course it was inefficient for what was happening not only to your own family and friends, but what did you see when you gave the market a scan at that time? And where were we, I guess, on the macro as maybe a society? What were you seeing at this moment in time when you're starting to think about launching the company?
Yeah, there were a couple different layers of it. First was that experience that seemed to dominate so many of ours still today, which was security questions. How are we in a world where the credit bureau answers, or frankly, many companies have had data breaches and disclosed data that's now publicly available that bad actors can use to answer our security questions. We said, okay, this method isn't working. The next layer often became this idea of getting a text message, sort of an SMS PIN code. And I said, okay, well, that's a little bit more established as a method of sort of verifying who someone is. And then I started working with some of the telco companies and did some research and exploration there, only to find that they had the same challenge of identifying who an actual user is. Meaning if you get a new iPhone and you call your telco and say, hey, I got a new phone, can you move my phone number over? They have the same challenge of saying, are you actually the person whose account we think this is, such that we can move your number over? And I've since learned that became a main way that bad actors, are able to take over accounts, because they take over your phone number first and then get those SMS PIN codes. This is not a solution long for the future. This isn't going to work much longer. And then you got into this world of saying, I think this concept of identity verification, and that's a big category, but by it specifically, I mean what you might have gone through, let's say when you opened a new bank account, or in financial terms, it's a KYC, a know your customer process, sometimes to prevent money laundering. Let's say when you open a new bank account, if you're doing it in a remote way, a bank might ask you to scan your ID and to take a selfie. Scan a driver's license, a state ID, a passport, whatever it is, and take a selfie. So I said, okay, that technology has existed for a while. I said, can we use the technology that's out there to somehow make that sort of reusable, or maybe to fortify it in a better way, or make it easier to use? And when we turned out through a lot of research and trying most of the providers out there, where they were actually all very similar, and that they existed in a web browser, whether it was a desktop or mobile, it didn't matter, but technologically they were in a browser. And what that meant was it was very convenient for someone to be able to scan their ID and take a selfie kind of anywhere they were on any device they were on. But unfortunately, it meant that it was susceptible to bad actors doing malicious things to interfere with that flow, meaning it couldn't be used for security. It was fine for kind of regulatory compliance, but it wouldn't work for security, which is why it turns out companies couldn't use it for calling to verify. Let's say that, we call the help desk to verify you're the account owner, or when you're trying to reset your password or reset authentication factors. And so that's what led to the challenge after we looked at the market to say, gosh, there has to be a better way to do this. And that led to really the product innovation of taking the same experience of scanning your ID and taking a selfie, but doing exclusively on mobile devices. Because mobile devices, it turned out, differently from web browsers, would afford us a lot more advanced features, security technologies that are available in these modern mobile phones that you don't get in a web browser. And that key innovation allowed us to build a fundamentally different identity verification product that could then be used for security use cases.
I love it. So you set me up for the jumping off point. We're going to ask, and I'll ask right now, who is NameTag, but also too, and I know we're going to kind of weave in here this notion around healthcare, right? As you know, we have some incredible thought leaders and passionate executives and leaders of the industry that tune in on the regular here. And we want to really also frame this work around what does this look like for those cybersecurity investments for our CIOs and CISOs? What does this look like? And we've seen it now time and again around these ransomware attacks that have literally paralyzed healthcare organizations. And when you think about that, it's not just some business that might be circulating files, if you will. This is actually organizations that is delivering care, life-sensitive care, right? So let's talk about that as well. But before we dive into some of that, Aaron, let's first start as I just framed it up. Who is NameTag?
NameTag started as a way to verify who someone was kind of behind the screen. And we thought there were a lot of interesting use cases where that could sort of change the way we interacted. Think of social media profiles, knowing authentically, is this the person who has the profile? Dating sites. What a crazy way that you're going to get to know someone and build trust. And if it works out well, you're going to meet up in person, but you sort of only sign up with a social media profile or a disposable Gmail account. It turned out that wasn't the prime area for our technology. Because we listened very closely to some of our earliest customers, what we found was that people were saying, hey, the world of digital accounts that really mattered, things like protecting maybe your patient data, maybe your corporate email systems, maybe access to the medical infrastructure that providers use, a whole variety of systems. The concept was that for a long time, there was sort of a forgot my password button. You lost your password, you press the button, and you reset it. But in order to improve security, most companies have been moving towards implementing what's called multi-factor authentication, or MFA. Maybe you download an authenticator app, you get some kind of revolving PIN code, and it's an added layer on top of a password. But when companies added that technology for security, it unfortunately meant that the forgot my password button went away. And so if you get locked out, if you upgrade your phone, if something goes wrong, and it happens a lot, you have to call customer support. You have to call a helpline. You have to call your IT help desk if you're an employee to get that reset. And it turns out that suddenly becomes a huge vulnerability. And cyber attacks now, particularly in healthcare, start at the help desk. Because as strong as the authentication technology is, there's this human way of simply saying, hey, my MFA no longer works. I can't access my account. Can you reset it for me? Maybe some security questions come back into play. Maybe the opportunity to social engineer, as we say it, or kind of con the help desk rep come into play. And it turns out this is the avenue that bad actors are using to impersonate you. So it's not about you just upgrading your phone and suddenly being locked out. It's the fact that someone else can call and pretend to be you and that they're upgrading their phone and they can take over your account. So our technology focuses on those use cases. We focus on giving help desk agents a tool they can use to verify who the person really is at those kind of high value moments, high risk moments. And we created a way for companies to bring back that forgot my password button in the world of MFA so that companies can offer a self-service way for people to verify their identity. And then we reach into platforms like Okta and Duo and Microsoft that provide the authentication or login technology to automate that reset flow. So you don't need to call the help desk anymore when you're locked out. And those kind of breakthroughs and then some newer areas now, we think a lot about onboarding and, who's a new hire that you might have made. How do you make sure, the hot term today is, make sure they're not a North Korean, which I used to kind of think I put in air quotes, but actually turns out people are hiring a lot of North Koreans and a lot of North Koreans are out applying for fake jobs. It's all the same process, verifying who someone is at a high risk moment. That's what we do at NameTag.
Well, thank you for that, Aaron. And of course, like you said, you kind of weaved in there a little bit around the healthcare industry and how you're thinking through that and how your team is going about it. So let's also go there. Let's dive into that a little bit more, kind of framed it on the front end, how our CIOs and CISOs should be thinking about this world, this notion of patient safety, these cybersecurity attacks. We have seen some of these ransomware attacks. I mean, we're talking tens, hundreds of millions of dollars, locking entire health systems down. Then you're not even thinking about the downstream impact as well in regards to a HIPAA violation. And now all of a sudden legal lawsuits around that. I mean, this is just a world of hurt for our healthcare systems. And of course, this is top of mind. So how are you and the team thinking about that and those stakeholders within this very important industry that is called healthcare?
We have been surprised at how many of our customers, how many of the people that come kind of knocking on our door are in highly regulated industries. Often it means financial services, and often it means healthcare. And so what's happened in the last 12 months has kind of been astounding to watch because it's one of these areas where, particularly in the US, our regulators and our governments and associations that we rely on have been flagging this as a critical problem. And yet providers have not been able to move fast enough necessarily to keep up with. MGM, the casinos in Las Vegas kind of made the news in August of 23 when they had a breach that was this way. A bad actor called the employee help desk, pretended to be the employee, took over the account, deposited ransomware. MGM went down for 2 weeks. That was the start of it. But by November of 23, the FBI and the Cybersecurity Infrastructure Agency warned against this specific type of attack targeting healthcare. By January, it was the American Hospital Association. By April, it was Health and Human Services. It just kept going on. By June, it was the cybersecurity provider Mandiant. Consistently, month after month, everyone is warning that healthcare is the target. And so I actually spent a lot of time kind of brainstorming with people like, why? Why is healthcare in particular such a target for these kinds of attacks? And it turns out the underlying value for a bad actor, if they get a hold of someone's personal health information, right now trades for a much higher price than having someone pure personal information. So health information of a patient in particular is incredibly valuable, let alone the ability to take over your provider's critical systems or, if you access a provider's login, you can suddenly access patient data at higher volume and scale. So whether it's the end patient or whether it's the provider or anywhere up and down the value chain in healthcare, getting access to patient data is higher value.
Aaron, thank you for that as well. It is really a critical point, right? We did see some of those alarm bells going off. And of course, they're still with us today. I mean, we are still incredibly vulnerable. I'll say it is what it is, but healthcare, we lag a lot within our IT infrastructure kind of environment and kind of where we are with the adoption of new technologies, et cetera. We are getting better. There is incredible pace happening now. I think a lot of what we saw some acceleration because of what you said really on the front end as well. The pandemic, right? That really changed the paradigm for a lot of things, including the healthcare industry. So we are seeing the acceleration of new technologies, new ideas, and most importantly, from my perspective, new ways of thinking of how do we safeguard this incredibly vulnerable, incredibly important industry that we all so dearly love called healthcare. So Aaron, when we think about those stakeholders, the CIOs, the CISOs, then of course all the way up to the CEO and then all the way up to the board or otherwise, some of these being public entities, whether you're talking about HHS or CMS or otherwise, what are some of the key, if you had to boil it down to say 1 to 3 or 3 to 5, what are those big boulders that you want to share with those stakeholders in healthcare that they should be keeping top of mind, given what you and the name tag team are seeing consistently out there in the marketplace?
Multi-factor authentication is a critical tool that needs to be deployed to protect your workforce and to protect your patient accounts. It is necessary, but it is not sufficient. So step 1 is make sure you have MFA in place. And if you are anywhere near the IT infrastructure of a hospital, a provider, a medical institution, an academic institution related, please, please, please make sure that that is sort of the norm and the baseline you have. Step 1. Step 2, you need to think about what it means when someone can call your help desk. And typically I would say, hire someone to go do a penetration test of your help desk. And if you're super curious while you're waiting to get that contract in place, try it out yourself. Right? Literally pick up the phone, call your help desk, whether you pretend to be a patient or you pretend to be an employee in the workforce, and see what happens. See what kind of questions you're asked. See what the processes are that your organization might have in place. And it gives you a sense of, is there a plausible chance that someone might be able to deceive them with the average tier 1 support rep? That's a really important baseline to do to get a sense of how robust your organization is. And third is sort of think about then what practices or options you might have to take a further step to enhance the security of your infrastructure and the data that underneath it.
Excellent. Some nice pro tips for our leaders within the industry. So thank you as well on there for sharing all of those, Aaron. Let's also now talk a little future state. We'll grab the crystal ball off the shelf. Things are moving rapidly as we just kind of discussed, but where are things heading? What are you seeing with name tag, not only the company and what you guys are doing with the org, but of course, more broadly across the industry? What are you seeing that we need to be mindful of over the next several years? What's keeping you up at night? And what are the things that we should be keeping our eyes on as well?
Yeah, I think there are at least 2 categories. I think one trend that we're seeing enormously is what people are doing with this health information. And, it was very real for me because just last night, as I was thinking about what we were going to talk about today in our conversation, someone called me and they said, "You're never going to believe this. I got a phone call today from someone pretending to be a collector for medical debt. And they said that I had not paid my provider. And they had my birth date and they knew about my conditions and they had a whole list of things. I called my provider and it turns out they had a data breach." And so someone, a bad actor, had used the PHI that they obtained to do much more targeted a phishing attack in that case, or, calling an outbound call and trying to trick someone into it was, "Hey, you owe me money. I'm a collection agency. Here's how you would pay," right? They were using that information to create a more targeted attack. That is a huge trend that we're seeing. It's one of the reasons why people are after and why this personal health information is trading for so much more. So big theme number 1. Big theme number 2 we're seeing a lot of is deep fakes, where people are using sophisticated Gen AI technologies to do this sort of social engineering that we're talking about. Because it's one thing if you can answer the security questions. It's another if maybe you can mimic the voice of the person. Or let's say you're an organization that's taken the most extreme solution you can today, which is, "Hey, employee, doctor, you're locked out of your account. Great, let's jump on a video call because I want to see you in person. I want you to hold up your ID. I want to really make sure it's you." Well, now you can actually run a deep fake of yourself, or someone could run a deep fake impersonating you in an incredibly easy and high fidelity way in real time on Zoom, on Teams, or on other platforms. So people are increasingly using deep fakes to do more advanced impersonation. Another big theme. And the third one I'd say we're seeing a lot of right now is this impersonation happening at the hiring level. And obviously, if you're an on-site medical practitioner, maybe a little bit less relevant, but certainly in the world of remote workers, we're seeing an incredible surge right now in people pretending to be someone else, applying for a job and getting that job. And the typical process, let's say in the US, of doing an I-9, are they illegal worker, is simply not robust enough. IT then issues email credentials and log into this new person. And time goes on, and this person is either on payroll, access to sensitive information, stealing information, sometimes just not showing up for work and collecting a salary, whatever it might be. But impersonation attacks are happening at the moment of hiring and onboarding. So these are the things that collectively really worry me. And nowhere does it worry me more, keep me up more at night than in healthcare, because of how much healthcare is just under attack right now.
Well, good things to keep top of mind, not only for today, but of course tomorrow. And I'm sure you probably know better than anybody running your organization, Aaron, it's only going to continue to come at us faster and in more augmented ways, especially as we continue to think how rapidly the entire AI world is evolving literally before our eyes. So a lot of good things that we need to continue to keep top of mind, not for today, but also for tomorrow. Aaron, we'll bring it back. We'll throw the crystal ball back on the shelf. We'll bring it back to current state. As I mentioned to you before we started recording, incredible leaders tuning into the podcast love to help our guests. So with that, we want to hand it over to you and ask, what's one problem, need, or question that you have that our community can be helping you with?
We love to learn about the risks that you're seeing in these environments. Please, I love hearing stories. I'm sometimes a collector of fraud stories or impersonation attacks, which I don't mind because it allows us to learn from them. Please share stories. Unfortunately, if you've had bad experiences or you know colleagues that might have. And then certainly if we can be helpful to any sort of operator, IT infrastructure, CISO, security practitioner in the healthcare space, I deeply feel that responsibility to keep the healthcare information, particularly of Americans, we're an American company, but globally, patients and providers, the infrastructure of this country, I believe, depends on cybersecurity at the moment. And I think we have to take more aggressive steps to protect that infrastructure. So I would love to be of help, to be of service, frankly, wherever we can be.
Well, in order to have those conversations with you and the team, Aaron, how do our community members get a hold of you? Social media handles, websites, or otherwise, how do they track you down online?
LinkedIn's probably our most popular platform. I'm there. Love hearing from you there. And I try and publish and create a lot of content that can be useful just in educating people on what we're learning about the space and the risks that are there and the things to consider as these risks are popping up. So it's a great place to sort of learn more, to engage, and certainly to reach out.
Excellent. And what's the website? Let's go ahead and highlight the website as well so we can drive folks over to your guys' landing page.
GetNameTag.com. Very straightforward. So when you're back from mowing the lawn or whatever you might do while you're listening to these great podcasts, GetNameTag.com is where to find us online.
Easy enough. And for those contact points for our listening community in your favorite podcast player, just simply scroll on down into the episode notes. Those contact points will be there for Aaron and the NameTag team. Of course, you could head over to our free global online community at passionatepioneers.com. There will be a post for this episode where you can leave comments, feedback, suggestions, or otherwise, and grab those contact points for Aaron and his team. Again, over at passionatepioneers.com. Aaron, an incredibly important conversation. Love the time we were able to spend here, spend time with our community to share a bit more about all the incredible work that you and the team are doing at NameTag. But of course, before you let you out of here, one little piece for you left. It's a fill in the blank. I'm a passionate pioneer because
my mission is to protect every human identity from impersonation.
Absolutely love it. Well played. And of course, as you mentioned on the front end, one thing that we could always be doing as well is listen. Absolutely love that advice on the front end. Good stuff, my friend. Aaron, thank you so much again for being with us today, spending time with the community, sharing all the great things happening within NameTag. We're looking forward to continuing to following the important journey you and the team are on as we continue to move this industry forward. That means so much to so many of us. Aaron, thank you again for being with us today.
Thanks for having me, Mike.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.